tested. Aflibercept 8 mg injection in patients with neovascular AMD, a 60-week visit from the PULSAR study, the same study. And I actually have a question for Jamie. Oh, it's working. Oh, yeah, that's
sometimes
amazing.
It does.
No, but before that, I have a question for you. Why do you think, PCV is definitely a more aggressive disease, and the results are very similar to the regular study. Would you have a comment on that?
I think we've learned from Planet study that, in fact, PCV also responds very well to aflibercept 2 milligrams. So these results were kind of confirming that, but in addition, with 8 milligrams, we saw a even better durability profile. Thank you.
Okay, thank you. So go ahead, Paul. Cross our fingers that it's
Thank
working.
you, Gabriel. Thank you all. It's a great pleasure on behalf of the PULSAR study investigator to present you the results, both at 60 weeks and the results at 96 weeks, 2 years, in patients treated for neovascular age-related macular degeneration with intravitreal aflibercept 8 milligrams. Some disclosures. So Jamie has greatly summarized the design of the study. Then she concentrated on the polypoidal lesions. Now we go back to the overall population, and the study is the same one. 3 groups of patients randomized 1:1:1. You see a group of patients assigned to the normal aflibercept. We are currently using 2 milligrams. The other group, 8 milligrams, the high dose, Q12, and the other one, 8 milligrams, Q16. All the groups received the usual 3 initial injections during the loading phase. And then you have the primary endpoints at week 48, mean change of visual acuity. This is a non-inferiority trial with a 4-letter margin. And then you have some key secondary endpoints. We may be familiar with the intraretinal fluid and subretinal fluid in the central subfield at week 16, but specifically for this presentation, for the EMA approval, we also have the mean visual acuity change from baseline to week 60. And then we have the end of the study at week 96, and there is an optional 1-year extension through week 156. You are now familiar, and Jenny has already shown this dosing schedule and regimen modification. Patients were randomized to each arm at baseline, not after the loading phase, and they had the possibility to have the interval shortening during year 1 and year 2, as you can see here. And during the second year, patients were receiving the possibility to be further extended up to Q20 and Q24 through week 60 and 96 respectively. And this is quite a long interval time with intravitreal injections. Here you see the patient disposition, baseline characteristics, no major differences, quite a good retention rate, although patients were recruited and treated during the COVID time, and you hear the discontinuation rate at week 60, reasonable. Let's go to the outcomes. Visual acuity outcomes in terms of visual acuity change and absolute visual acuity change, non-inferiority, so the high dose in both groups were non-inferior in terms of visual acuity throughout the course of the whole study, week 48, 60, and 96, as you can see here. What about the central subfield thickness? Very similar outcomes. The 2 milligram behaved very similar to the newer high dose at each single time point, as you can see here, and minimal fluctuation. This slide is very important because we are really keen to see how much we can stretch the interval time, and I mentioned week 20 and 24. So let's focus for week 60 on patients who were assigned to the Q16 interval at baseline. And you see that at week 60, 77% of those patients had a last assigned dosing interval of Q16 or longer, and this is very interesting. Let's move to the second year, end of second year, week 96. Let's pick up the all aflibercept 8 milligram. you see that 88% of the patients did receive a last assigned dosing interval of at least Q12, and of note, there are a higher proportion, 47% of Q20 or more, 28% reach in terms of last assigned interval Q24, or alternatively 6 months. This is really, I would say, something newer with respect to the 2 milligram. What about safety? There is a huge congress just nearby. It's the World Drug Safety meeting, and we are touching safety as well here in this meeting. So no major signals. I would like to concentrate on intraocular inflammation, and I don't see any signal through week 60. And remember, the 8 milligram means injecting 0.7 instead of 0.07 instead of 0.05. But luckily enough, there were no cases of IOP higher of 35 millimeters due to the injection, and IOP was taken within 30 minutes. So this is the summary slides. In terms of visual acuity gains, the 8 milligram group achieved gains which were comparable to the aflibercept 2 milligram through week 60 and 96. We observed anatomic improvement in patients treated with the high dose, and this improvement was early and maintained through week 60 and 96. This is very interesting because, again, that week 60 and 96, respectively, 91% and 89% of patients receiving aflibercept 8 milligram Q16 achieve at least Q12 or higher dosing interval, and 77 and 78 achieved Q16 intervals. And the safety profile of aflibercept 8 milligram is comfortable. Thank you very much.
Thank you very much. I think Jamie wants you to give it the coffee break, so we'll continue.
Okay, so the next talk is